Okay, so now we're going to talk about the part of the audit sheet that everyone gets intimidated by. It's the medical decision making. That's this section here. It is broken up into three sections. First, we're going to address the number of diagnosis, and that's going to correspond to this row down here that says A, number of diagnosis or treatment options. Okay. Then we're going to count data to be reviewed. That's this section here, and that's going to correspond with the row B. That's where we're going to make our notes down there. And then C is risk of complications and or morbidity or mortality. You have to look at this as column 1, column 2, and column 3. And we're going to go over this in just a minute. But that corresponds with row C down here, where we're going to make our notes to help us decide what level of medical decision making there is. Okay, so let's look at this. We're going to continue on with the patient. We did the history, we did the exam. Now we're going to work on the assessment and plan. Okay, so the first thing we need to determine is how many diagnoses is this patient being treated for in this visit, and how many points do we get to count for that? So if we go down here, I'm going to skip over this laboratory data for now, and I'm going to go to the assessment. It says this is a 32-year-old G5P4 at 36 weeks and 4 to 5 weeks with a urinary tract infection. The doctor gives a confirmed diagnosis of a urinary tract infection based on the lab, the urinalysis. So we go ahead and we say it is confirmed diagnosis. That's what we'll look up for our diagnosis code. But what we're going to do is go up here and say, okay, this is a new problem to this examiner. So it's either going to be new problem without workup or new problem with workup. And we would decide if they get 3 points or 4 points. So workup would be if, let's say, the patient did not have a urinary tract infection based on this urinalysis. The doctor might send them out for a scan and say, come back, in 5 or 10 days after we get the scan results back, and we'll talk about what's going on. That would be workup. He's sending the patient away to do additional testing because he's not sure what's going on with the patient. So this one would be a new problem without additional workup. So we're going to give him 3 points for that. Okay. We're going to go down here, go across to A, and that one's 1, 2, 3. We're going to put a little colored dot in there. Okay. Then we're going to go on to the next section. That's the only problem this patient is having, really, urinary tract infection, because all of those things that were going on at the top, the things she was complaining about, are symptoms of a urinary tract infection. Cloudy urine, urgency, frequency, etc. So now we're going to go to this section where it says data to be reviewed. Now it says review and or order of clinical lab tests, but we know that a urinalysis was done and he reviewed that or she reviewed that. So we're going to put a 1 right there. Review and or ordering of tests in radiology. Nope, doctor didn't do anything like that. Review and or tests in the medicine section of the CPT book. Those are things like sleep studies, and didn't do any of that, so we're not going to put any points there. Discussion of test results with performing physician. Didn't do that, so we're not going to get a point for that. Decision to obtain old records and or obtain history from someone other than the patient. Nope. Review and or summarization of old records or obtaining history from someone other than the patient and or discussion of the case with another healthcare provider. Nope. Independent visualization of image, tracing, or specimen itself, not simply reviewing the report. No. Okay, so we got 1 point for that urinalysis. So we're going to go down to row B and put a little mark right in this 1, minimal or low. So now we go down here. I tried to make them color-coded with the different sections to make it a little easier for you. Now we have to go to this table of risk of complications and or morbidity and mortality. We're going to look at this first column first, presenting problems. I consider a urinary tract infection to be an acute, uncomplicated illness. Okay, it's happening right now. It's pretty easy to fix with prescriptions, and it would fall into that category. So you're going to look down here and see where you think your diagnosis would fall in this column. So it says 1 self-limited or minor problem. This is something like a cat scratch or an insect bite or something like that. Low would be 2 or more self-limited or minor problems, maybe a cat scratch and an insect bite. Okay, 1 stable chronic illness, something like hypertension. Acute uncomplicated injury or illness. I would put a little mark in this box because that's what I consider a urinary tract infection to be. So we're going to put our mark there, but I'm going to go over these boxes a little bit more to help you understand better. So moderate would be one chronic illness with mild exacerbation, progression, or side effects of treatment. So if that hypertension, they're on medication, but it's still out of control, you would check this box, okay? It's kind of an exacerbation if you can't control it with the meds that you currently have the patient on. You have to adjust that medication. Next would be two or more stable chronic illnesses, something like hypertension and hyperlipidemia, or hypertension and controlled diabetes. Okay, they're both stable, the patient's doing well on the medication. An undiagnosed new problem with uncertain prognosis. This would be something like the patient did a self breast exam, they felt a lump, they go to the doctor does the breast exam, feels the lump, and the doctor says, I'm going to send you for a mammogram and an ultrasound, and we're going to see if it's either a cyst or solid. Okay, so that they don't know what's going on. Okay, so they're going to send the patient for additional workup. The next would be an acute illness with systemic symptoms. So this is something where, like, let's say the patient has an upper respiratory infection and they're wheezing and they can't catch their breath. Their respiratory system is symptomatic also. So I would count that for this. An acute complicated injury. This is something like a dislocated shoulder. It's going to require an additional treatment or additional procedure to fix it, that type of thing. Let me get down here to one or more chronic illnesses with severe exacerbation, progression, or side effects of treatment. An acute or chronic illness or injury that may pose a threat to life or body function, or an abrupt change in neurologic status. Okay, so an acute chronic illness with severe exacerbation could be something like COPD, and they're really struggling to breathe with it. They're having a really hard time getting their breath, their O2 sats are low, that kind of thing. An acute or chronic illness or injury that may pose a threat to life or body function. This could be things like a patient is showing symptoms of stroke. Okay, that could be another abrupt change in neurologic status. Another thing like this could be they have a crush injury to their leg and there's a chance that they can't repair the arteries in the leg and they have to amputate part of, below the knee or above the knee, that type of thing. They're going to lose function of that body part. Abrupt change in neurologic status is one of those dicey things. If a patient presents with weakness, they consider that an abrupt change in neurologic status. If a patient has a syncope or fainting, they consider that abrupt change in neurologic status. So that would put them into that high level of a presenting problem. Okay, so right now we have ours in this low because it's a acute uncomplicated illness. Then we want to go over to the diagnostic procedures ordered. We're not going down to row C just yet. We're going to go through this whole table and then we're going to make our decision on what we're going to put for C. So diagnostic procedures orders. If we go down here, we look at column 2. The doctor didn't order anything. He just said, take these drugs. If you don't feel better or you feel worse, make sure you get evaluated immediately and make sure you go see your OB doctor in the next few days. Okay, but nothing was ordered. So we're just going to leave this entire thing blank. This is pretty self-explanatory. If the doctor had ordered something, you just go find the correct box that has that type of procedure or test in it, and then you check that box. All right, now we're going to go over to management options, this column here. So again, this one's pretty self-explanatory. So what I'm going to do down here is I'm going to do, what did he do to manage this problem? The patient was given a prescription for Macrobid. So column 3, I'm going to look for that prescription drug management. He's prescribing it, he's giving her the dosage, etc. So I'm going to go down here and look for the box that says prescription drug management. This one has over-the-counter drugs. This one has prescription drug management. So I'm going to put a mark in that. Okay. So right now we have a mark in the low box for presenting problems, nothing for the center column, and then this moderate level for the prescription drug management. The rule on this box is you go as far down in any of the 3 columns as you can to get your level for that part of this medical decision making. So this one, the farthest down we can go is moderate. So we're going to take that moderate, we're going to go down to highest risk complication, and we're going to say moderate. right? Okay, so to determine, it's really hard to read here, but to determine the level of medical decision making, you're going to go with one of these columns that have two dots in it, or the one in the middle. So this one we had, remember, we had 3 for the diagnosis, we had 1 for the data, and we have moderate for the medical decision making. So we have 2 in this column, so our medical decision making is moderate complexity. All right, so I'm going to draw this up, and we're going to talk about how we select our level after that.